Lung cancer, a disease many know little about. The misconception, you can only get it from smoking. In 2005, my family was hit with a devastating blow. My mother was diagnosed with stage 4 lung cancer. The worst part, she was never a smoker. What are the odds of a mother of 5, a wife, daughter, sister, aunt, friend, being diagnosed with lung cancer and no one knowing why? Well, that's what I wanted to find out. I sat down with my family to get their reactions on my mother's illness, as well as talking to 2 oncologist hematologists. This is my story.
I didn't want to accept it, and I guess I never really believed it was going to happen. I believed a miracle was going to happen.
I couldn't believe it. I was in denial.
I was angry, and I didn't know why.
I was devastated, in denial, disbelief, and then I felt doubt. I was angry because I felt like the doctors had all those years that she had been complaining of having breathing problems, and they were saying it was bronchoasthma. I believe that the lung cancer was already in process.
Lung cancer is the second most common disease diagnosed among men and women in the United States. According to the CDC, the Center for Disease Control, in 2012, over 226,000 people were expected to be diagnosed and over 160,000 were expected to die. Anyone can get lung cancer, whether they are smokers or non-smokers. Non-smokers fall into an 8 to 10%. That percentage includes passive smoking, most commonly known as secondhand smoke, those who come in contact with environmental factors such as radon and asbestos, and the worst, the unknown. My mother fell into that 8 to 10%. I wanted to know if any of her previous medical history had any connection to her having lung cancer. I headed over to Dr. Philip Tsai's office in Teaneck, New Jersey for answers. He was one of the doctors that treated my mother. My first question, the screening process of lung cancer.
Well, screening is only advised for lung cancer for patients who are heavy smokers nowadays. That's the only recommendation that has been in any way proven, and that's with CAT scans of the chest. There is otherwise no recommended screening procedure for patients, for instance, who are not heavy smokers, and for patients who
there is an age demographic set on when one should be screened for different diseases. According to the CDC, one should not have a prostate exam, mammogram, or colonoscopy unless they are 50 years of age or older. If lung cancer screening is only given to those who are smokers, what happens to the unknown percent? Prior to my mother's diagnosis, she had been diagnosed with multiple upper respiratory infections. I asked Dr. Tsai, could that have been a factor?
Upper respiratory infections, no, because upper respiratory means from here up.
Okay.
You would be probably asking whether infections of the lung, which are lower respiratory infections, are in any way cause lung cancers. And the answer is most likely not. However, a previously undiagnosed lung cancer can cause a respiratory infection, a lower respiratory infection, by blocking off one of the airways that exist in the lungs and preventing normal air circulation and drainage of secretions because of the blockage. And that can cause those secretions that are trapped to become infected.
My mother was diagnosed with non-Hodgkin's lymphoma in 1997 while she was pregnant with my little brother. Due to her pregnancy, she was not allowed to receive radiation treatment. I asked Dr. Tsai, could that have been a factor as well?
None that that is known. Patients who are treated, however, for malignant lymphomas, and most of that data comes from treatment of Hodgkin's lymphoma, who have been treated with chemotherapy and radiation, can later get lung cancers. And that's because of the consequences of damage to the DNA from the combined assault by radiation and chemotherapy. But as a causative effect, not that we know.
It was great talking to Dr. Sy, but I needed more answers. I headed over to Climax Hospital in Belleville, New Jersey to talk to Dr. Saeed Saleh. He was not one of the doctors who treated my mother, but he knew of her condition. My first question was, could upper respiratory infections be any factor of lung cancer?
I don't think respiratory infection is a cause for this. What's happened most of the time, because of the presence of lung cancer, it can cause a recurrent infection, and that may be explained if she has recurrent infection, recurrent upper respiratory tract infection. The upper respiratory tract is not a cause, most likely it's a result of the lung cancer, because the presence of the cancer in the lung make the lung more susceptible to infection. And the reason why, because there will be non-clearing the secretion from the lung, and that's causing recurrent infection.
I also asked Dr. Saleh, could non-Hodgkin's lymphoma have been a factor as well?
It's not, but the relationship between the non-Hodgkin lymphoma and the lung cancer is maybe what kind of treatment she had in 1998. If she had radiation therapy, the radiation therapy by itself, if the lung was exposed to the radiation therapy maybe increased the incidence of the lung cancer.
Well, she was pregnant, so she wasn't allowed to have radiation.
If she was treated with chemotherapy, I don't think there is any chemotherapy can cause lung cancer. The only cancer can caused by chemotherapy is maybe leukemias and myelodysplastic syndrome, but there is no certain connection between the non-Hodgkin lymphoma and the lung cancer.
Being that my mother was adopted and she did not know her medical history, I asked Dr. Saleh, could that have been a factor?
Really, the association of the family history and the lung cancer is very limited. I don't think there is other cancer which has certain familial connection, like colon and breast cancer, not lung cancer.
It seemed as though there was no definite answer as to why my mother had been diagnosed with lung cancer. Despite having multiple upper respiratory infections and being diagnosed with non-Hodgkin's lymphoma, neither doctor saw those as factors. Unfortunately, in 2008, my mother's health took a turn for the worse. She kept going in and out of the hospital, and by the end of the summer, there was nothing more they could do for her. That is when hospice had to come in.
Yeah, it was the last resort. We couldn't do anything else. She wanted to be home, so it was the best place for her to be. We did the best of what we had in this house at the time, and we had to find the biggest room in the house, which was the dining room, and we cleared that out, and we put the bed in there, and that's how it was.
It was hard for me to watch my mother deteriorate right in front of my eyes. Her body was frail, and she was cold, and she just wasn't herself, and it was just at a point where I knew that it was over, but I didn't want to come to terms with the fact that it was, and I became angry and lashed out at a lot of people because I was not comprehending the fact that my mother had lung cancer and she never smoked. I was not comprehending the fact that my mother was dying. I was not comprehending the fact that she would not be seeing me go to prom. She would not be seeing me graduate from high school. She wouldn't be helping me pack and go away to college. She would never see me have children of my own. that she was gone, and that everything that she gave me I had to hold on to, because I would never ever get anything else from her again. But despite the materialistic things, I cherish her memories every single day.
She was a sweetheart. She was a nice person. She was very caring. She was very loving. She was very giving. That's about it, and we miss her.
She was a great lady and one of the sweetest ladies you ever wanted to meet. She was loving and caring. She was a great mother. She was a great person. She was a great wife. And she was just, she's truly missed. And I will miss her forever.
We taking it one day at a time, and hopefully, with the help of God, we know she's still alive in our hearts. We know we was loved, and she knew she was very well loved. And we will meet her again one day when our journey is completed.